Hi, everyone. Thank you so much for coming today for this important announcement. We will now begin our press conference with HHS Secretary Robert F. Kennedy, Jr.
Hello, everybody. And thank you so much for being here. Congressman Guthrie, thank you for your leadership in Congress to strengthen protections for organ donors and transplant patients. Thank you to Health Resources and Service Administration Administrator Tom Engels, who will join me in a minute, and Dr. Raymond Lynch, who's chief of the organ transplant branch at HRSA. And thank you for your leadership. And thank you to Donna Rover and to her brother TJ Hoover. Your courage in telling your story helped expose the serious failures in our organ donation system and remind us why this work matters so much. The federal government's first responsibility is to protect human life and patients. When Americans register as an organ donor, they make one of the most generous decisions imaginable. One donor can save up to 8 lives and enhance dozens more. Yet today, more than 103,000 Americans are waiting for life-saving transplants. Every one of those donors, every one of those families, every patient waiting for that gift deserves complete confidence that our organ donation system is safe, ethical, and worthy of their trust. That confidence also depends on physicians and nurses and transplant professionals who performed a record-setting more than 49,000 organ transplants last year. They deserve a system that respects their medical judgment and puts patient safety first. Maintaining that trust requires strong federal oversight. Under the Biden administration, HHS failed to hold organizations accountable when serious patient concerns emerged. Today, we are restoring that accountability. We will not tolerate organizations that compromise patient safety or betray the trust of donors or their families. I'm announcing that HHS has become the decertification of Network for Hope, the organ procurement organization serving Kentucky and parts of Indiana, Ohio, and West Virginia. We reached this decision after extensive reviews by CMS and HRSA found persistent patient safety failures despite repeated oversight, repeated warnings, corrective action plans, and multiple opportunities to improve. Federal reviewers found serious deficiencies in nearly 30% of the cases that they examined. We found patients placed on the organ donation pathway who should have never been there. We found cases with the donation process continued despite signs that patients were not appropriate organ donors. We found repeated failures in clinical judgment, oversight, and patient safety. And we found that these problems continued even after the organization promised to correct them. These failures had real consequences. One of those cases involved TJ Hoover. TJ showed signs of awareness while on the operating table about to have his organs removed. Physicians refused to proceed with the organ recovery because they believed that he was still alive. Because they acted, TJ is alive and is here with us today. TJ, we are grateful that you're here, and we're grateful to those physicians who had the courage to do the right thing. TJ's story is a powerful reminder that every safeguard exists for a reason. Most organ procurement organizations carry out this work with professionalism, compassion, and deep respect for both donors and recipients. But Network for Hope repeatedly failed to meet those standards. It was a bad apple. When an organization entrusted with the gift of life repeatedly puts patients at risk, the federal government has the duty to act, and that's why we're acting today. President Trump directed this administration to restore integrity, strengthen patient protections, and rebuild trust in the American organ donor system. That work began last year, and it continues today. An organ procurement organization is entrusted with one of the greatest gifts that a human being can give, the gift of life. That responsibility demands excellence, it demands transparency, and above all, it demands respect for the dignity and sanctity of every human life. I had a nephew, Michael Hines, who a little over a year and a half ago, he was a 20-year-old boy who had been born with cerebral palsy, but his body was that of a 6 or 7-year-old, and that's how I always think of him, although I was with him for almost 20 years. And he had an accident at his school 2 years ago, and his brain died. And our family made the decision to donate his organs. We were in an Orlando hospital, and we kept him there for 3 years, for 3 days, while the respirators kept his body alive. And our family sat with him 24 hours a day. In the end, he made 11 contributions, including a life-saving contributions to a 9-year-old boy who got his heart, and a life-saving contribution to a mother of children with intellectual disabilities who got his liver. 11 separate recipients received his organs. And when we operated him, when we brought him to the surgery room at the very end of his life on the 3rd day when he was ready, and the organ recipients were ready, the organ donor organization, the hospital, put on a march of heroes with the entire hospital community participated, walking us through the hospital corridors with people standing respectfully by till we brought him to the surgery room. And he was able to give the ultimate gift, which was life to other people. And he, in our view, he continues to live today through those people to whom he donated those organs. Everybody who donates an organ and everyone who receives an organ deserves that kind of dignity. And unfortunately, this organization was neglecting that bond of trust. We owe that standard to every donor, we owe it to every family, and we owe it to every patient waiting for a chance to live. And thank you, and now I want to introduce our HRSA Administrator, Tom Engels.
Thank you, Mr. Secretary. And Mr. Secretary, sorry for your loss, but stories like that happen all across this country, and there are success stories, but unfortunately, that's not what we're talking about today. Good afternoon. I'm Tom Engels. I'm the Health Resources and Services Administrator. At HRSA, we oversee the nation's organ donation and transplant system, including federal oversight of the Organ Procurement and Transplantation Network, or OPTN. Our responsibility is to provide strong federal oversight, promote accountability, protect patient safety, and hold organizations entrusted with organ procurement to high standards, expected patient care, and donor families expect that care. Over the past year and a half, under President Trump's leadership and Secretary Kennedy's leadership, HRSA has led the most significant modernization of the OPTN since its creation in 1986. Strengthening oversight, improving transparency, advancing patient safety, modernizing governance, and investing in technology that supports a stronger transplant system. As the Secretary said, last year we had a record number of transplants in this system, in this country. That is a true thing to be celebrating. This reflects HRSA's broader responsibility to modernize the nation's organ donation and transplant system to ensure it operates safely, transparently, and with the accountability that the public has come to expect. Organ, eye, and tissue donation are extraordinary gifts. Our responsibility is to honor those gifts by maintaining a system that patients, donor families, and the public can trust. That's why, for over the past year, as the Secretary said, HRSA has worked diligently to address serious patient safety concerns involved with the Network of Hope. HRSA directed the OPTN to implement a comprehensive corrective action plan while independently analyzing operational data, coordinating with CMS, and assessing the implementation of required corrective actions. Throughout this process, our objective remained consistent: to support meaningful improvement while keeping patient safety at the center of every decision. Despite intensive oversight, ongoing monitor by the OPTN, and repeated opportunities for improvement, significant patient safety concerns remained. I want to emphasize, even though the action that the Secretary is announcing today, care will still be offered to the patients that are served by this organization. That will not stop. HRSA and CMS will continually closely monitoring the organization. Secretary Kennedy today delivered action. Actions are words, but he has stepped up and for once again has said, we will stop the bad actors. I want to thank you, Mr. Secretary, for your leadership and your continued support.
Hello all. Senator Kennedy, Administrator Ingalls. I'm Donna Rohr, T.J. Hoover's sister. I was there. I saw what happened to my brother. They prepared to recover his organs while he was still alive. During that honor walk, his eyes were open. He was tracking me, and they told me it was just reflexes. Then during the heart cath, he was thrashing, crying, and grabbing the doctor's hands to stop him. Even after those signs, the organ procurement process continued until the physician refused to proceed. One of the organization's own coordinators called the home office after the doctor refused. She was told, "Find another surgeon or you'll lose your job because we're finishing this case." My brother almost died that day. That should never happen to anyone. Laws and standards were clearly violated. Those responsible must be held accountable. When they finally stopped and acknowledged TJ was still alive, they sent him home with me and said, "Make him comfortable. He will not last." Well, it's been 5 years and he's still here. I'm grateful every day for that, but he is not the same. He has nightmares. He struggles remembering things. And he asked me, "Sis, why do they want to kill me?" I don't have an answer for him. I'm just his sister. But I know what I saw. I had to quit my job to take care of him full time. We're barely scraping by. My life is taking care of my brother, and it wears me out sometimes. But this isn't just about TJ. Families deserve confidence that every patient is treated safely and every safeguard is followed before organ recovery is ever considered. We're talking about real lives and real families like mine. I want immediate action beginning here in Kentucky. I want every person who hurt TJ and other patients identified and held accountable under the law. All of these people should never be allowed to provide patient care again, because if we don't act, this will happen again. I'm not going anywhere. I'm TJ's sister, and I will keep fighting until the people responsible are held accountable, so no other family has to live what we're living through. Thank you for coming, Mr. Kennedy. We know patient safety matters to you, and I hope you'll help make sure this never happens to another family again. Thank you.
Thank you. Thank you for your coverage.
Thank you.
Thank you so much. We will now start our Q&A from our reporters to the left. Start right here. Please list your name and outlet, and if you could keep it to the topic of today's important announcement, that would be great. Thank you.
Lawrence Wilson with the Epoch Times. Could you please say more about how there would be continuity of care for organ donors and recipients in the state of Kentucky?
Yeah.
HRSA and CMS will work together to continue to monitor make sure that they're taking care of their patients, but we will closely monitor them throughout this process as CMS goes through a process to replace the organization that's here.
Any other questions? Okay. Thank you all so much for being here today. That concludes our press conference. Thank you.